Hello, my name is Amanda Gore. My research topic question was how the Affordable Care Act affected patients with long-term chronic illnesses. And the resources that I used, one is an article called A Cure for the Affordable Care Act. This is from, excuse me, I'm looking up all my stuff here. This is from diagnosticimaging.com. It's one of those ones that is maybe not quite as reliable as other resources, but had an interesting take on the Affordable Care Act. And basically the essence of that article was how first it goes into the history of how the Affordable Care Act came to be and how Medicare came to be, and then the implications that has had with various large insurance companies leaving the Medicaid group and trying to form their own mergers, which essentially would create their own monopoly because they would be so large and they would be able to set their own insurance premiums, which would increase the cost of health care, obviously, as well as the groups that remained in Medicaid would have to increase their health care premiums because they didn't have as many people in the Medicare group, providing care, so they would have to increase their premiums in order to stay afloat. So it talks about how Medicare was created to fix the problem of people not having health insurance and not having options for health insurance, but then inadvertently created another problem of increasing costs and the lack of options, essentially. The next article that I used is called The Impact of the Patient Protection and Affordable Care Act on Radiology Beyond Reimbursement. This is from the American College of Radiology itself, the journal that they produce. And this is a very interesting article that talks about the non-financial aspects of the Affordable Care Act and how healthcare has changed from a fee-for-service to the focus on a value-based healthcare gauge. So it goes in to talk about the surveys that I'm sure we all have, if we've worked in a hospital, have experienced, that we have to give out however often your hospital does it, and how those surveys can guide radiology specifically into providing better care that the customers will value, that the customers can look up and can make an educated, informed decision on for those patients that are looking to get into a different hospital or different physician or whatever the case may be, especially because that radiology is being used so much more now with diagnostics and preventive health care. The cost is going up, the out-of-pocket cost is going up, so patients need to be able to have these informatics to be able to make a decision on where they would like to be treated and who they would like to be treated by. The next article is called The Affordable Care Act and End-of-Life Care, A Voice for the Dying. This is actually from the George Washington University. It's like a report that someone had put out There's actually no author, so I don't know if it was from a student or if it was something that perhaps one of the instructors at the university put out. But this goes into talking about cancer and how the Affordable Care Act has affected, what's the word I want, palliative care, so end-of-life care, because previously with the fee-for-service, or not fee-for-service, excuse me, with the healthcare that we had prior to what we have now with our ACOs, patients were all reimbursed at the same flatline amount, and so it was more financially better for a patient to die quicker, per se, than to be treated and have a good quality of life, even though they may be terminal, still getting treatment for pain, discomfort, and whatever. It goes into speaking about ACOs and the payment model, focusing on quality of life and value-based care versus the old HMO kind of ideal that we had prior. And then the other article, my last one, is called Obamacare, a game changer for MS patients. This is from, excuse me while I look it up, it's from healthinsurance.org. It's another one of those kind of iffy sources, potentially from an opinion-based point. But this article, I'm going to scroll back up so I can look at my synopsis here. Obviously it talks about multiple sclerosis and how these patients often struggle with being able to work. So they're faced with financial problems, and the insurance was limiting because Medicare had specific goals, or not goals, things that you need to meet, requirements that you needed to meet before you were able to get it, and there was like a long 24-month waiting period of getting it. And it goes into talk about how with the Affordable Care Act, Medicare has changed those guidelines that you need to meet that make it a little bit easier for patients to get Medicare and Medicaid, and it gives patients more options for providers. It gives them more options as far as lower coverage for premiums. So it's talking about how the ACA has been a good thing for MS patients. It does go on to speak about prescription medication and how that's one thing that is still not very well covered, and diseases that require a lot of prescription medication, there's room for growth in this area because they need constant medications and coverage and such. So that's where this ACA lacks, essentially. So from reading all of this, I found it interesting. My mom had amyotrophic lateral sclerosis, ALS. For those of you who haven't heard of that, you may have known it as Lou Gehrig's disease. This was a big hit to the family. And so we had to deal with a lot of issues with insurance. One, not trying to cover the MRI, which was required for a diagnosis. And perhaps it took 6 months to get her diagnosed, and then she passed away 6 months after her diagnosis. So perhaps had she been diagnosed earlier, she could have been given some more end-of-life care, which could have eased her pain and suffering a little bit. She was suffering very much so. So that was also during a time where HMOs ruled versus ACOs, excuse me. So again, this was the same theory of patients it'd be better for patients to die faster, because a patient that had a terminal illness that required a lot of medical attention was getting the same reimbursement rate as a patient that was getting maybe annual physicals, that was healthy as an ox, and able to have minimal medical expense on the government, perhaps. So it's an interesting kind of thought process here about how things could be different, because Mom passed away in 2004, and with the Affordable Care Act, not that we were in a bad financial situation. Both my mom and my dad made good money, but for patients who do require the additional help from the government, how different today would have been for those patients versus patients in the same time period as my mom. It was kind of eye-opening doing all this research, to the point that I think it would have been better with all of the options and how the premiums could potentially be lowered. But there's conflicting interests. Obviously, that's why I included that other article which talked about how premiums would be increased, to kind of talk about how there's still a lot of debate in the air between good and bad on this, and there's not a whole lot of information out there on this topic. This was actually a really difficult topic to research. Most research that I found went into things like diabetes, which, although chronic, and I know there's a lot of issues with funding for that and patients being able to get their meds on time, this is a different kind of treatment option, and terminal care specifically is hard to find with this topic. So this was definitely an eye-opening experience. And as I said, for as far as future considerations, the medications, the prescriptions, which was I just kind of spoke about with diabetes as well, that's a prescription thing. I think the ACA still has room to grow in helping reduce the cost of prescriptions, out-of-pocket cost of prescriptions to patients. There's just a lot of people out there that are struggling just to survive. I mean, with diabetes, we talk about type 1 diabetes specifically. Those patients require insulin to live. That's something that is required for their life. And a lot of them struggle to pay for the insulin and the needles and all of the equipment and medications that they need, which is just absurd. I don't know. I think that this, whatever health reform that we may be going through now with President Trump, needs to address this as well if we do end up getting rid of the ACA and the Obamacare. I think there needs to be a huge reflection on prescription medication and making that more affordable. And a lot of premiums are still out of reach and unaffordable, and I think that needs to be addressed as well. But this was certainly an informative and very difficult research topic. But I'm glad I did it. So I hope that maybe I gave you guys a little bit of insight too, and I apologize, my cat is an attention whore, and she can't leave me alone for 5 seconds, so That's why you see her walking around me right now, crying for mama's attention. But anyway, thank you so much for listening, and I hope that you all have a good week vacation before starting your next semester. Thanks. Bye.